Hello everyone, today I'll be talking about primary hyperaldosteronism in brief. As the name itself suggests, primary hyperaldosteronism is overproduction of the aldosterone hormone which occurs due to abnormality in the zona glomerulosa of the adrenal gland. Primary hyperaldosteronism can occur due to a variety of causes, some of which include adrenal adenoma, which is also known as Conn syndrome, or primary hyperaldosteronism can be associated with bilateral zona glomerulosa hyperplasia. This bilateral zona glomerulosa hyperplasia can either be idiopathic, which means that its exact cause is not known, or it can be adrenocorticotropic hormone dependent. Abnormality of zona glomerulosa of the adrenal gland causes overproduction of aldosterone hormone, which further leads to sodium retention, potassium loss, and metabolic alkalosis. Clinical features of primary hyperaldosteronism can include development of hypertension, development of features of hypokalemia such as generalized muscle weakness, and cardiac arrhythmias. Some patients can also develop polyuria due to impairment of urinary concentrating ability. Investigations for primary hyperaldosteronism can include plasma aldosterone concentration, plasma renin activity, estimation of serum electrolytes, which can reveal hypokalemia, and arterial blood gas, which can reveal metabolic alkalosis, and imaging studies such as a CT or a MRI scan to look for adenoma and hyperplasia. Once the diagnosis of primary hyperaldosteronism is established, then its management can include a combination of drug therapy and supportive therapy. Surgical intervention may be done in case of adrenal adenoma. Just a few points of differences between primary and secondary hyperaldosteronism. Primary hyperaldosteronism is the overproduction of the aldosterone hormone, which occurs due to abnormality in the zona glomerulosa of the adrenal gland. Secondary hyperaldosteronism, on the other hand, is overproduction of aldosterone hormone due to stimulation of the renin, angiotensin, aldosterone system. In primary hyperaldosteronism, the plasma aldosterone concentration is elevated and the plasma renin activity is low. In secondary hyperaldosteronism, plasma aldosterone concentration is elevated, and along with this, the plasma renin activity is also high. Edema is usually not a feature of primary hyperaldosteronism. Edema, on the other hand, is usually a feature of secondary hyperaldosteronism. However, secondary hyperaldosteronism in Bartter syndrome and Gentleman syndrome occurs without edema. Here is the overview of differences between primary and secondary hyperaldosteronism. So this was all about primary hyperaldosteronism in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video, and subscribe to my channel. Thank you.